The truth about plastic surgery. First of all, sometimes people ask me, they say, Dr. Morwood, why do you call it plastic surgery? Is that because you use a lot of silicone in your work or plastic? Actually, the root in Greek, plastikos, means to mold, shape, and tailor, and that's what we do. Sometimes people say, Dr. Morwood, I know you go overseas and you do a lot of children with cleft lips and palates and you take care of cancer and things like that. They sometimes feel self-conscious or vain about coming in to talk about something aesthetic. Actually, it's normal, natural, healthy to want to look your best. When we see someone on the street who doesn't care about their appearance, we immediately recognize that something is a little off. It's in our DNA. We want to look our best. This is perhaps the most important slide I'm going to show today. When we talk about getting a natural result, avoiding that so-called done look, avoiding the look where you're pulled and stretched too much, we need to talk about the triangle of facial rejuvenation, the triangle of facial beauty. And this is how I think high quality plastic surgery should be addressed. It's certainly what we do in my practice. So the triangle has three parts, three corners. There's the skin texture. What do I mean by that? That's fine lines, dyspigmentation, the sheen of the skin or a lack of sheen. Then there's volume. Keep in mind that as we mature, we tend to lose fat in our hands and in our face, and we put that fat on in the trunk. It's an unfunny practical joke, right? But that comes with hormonal changes and time and aging, and just keep it in mind. We lose fat in the face and in the hands, and we put the fat on in the trunk. Now, the third part of the triangle, soft tissue transposition. Now, that's what most people think about as being plastic surgery. Certainly, we can reposition, we can remove soft tissue, we can remove skin, we can tighten firm, but that should be done judiciously, carefully, and oftentimes gingerly, because we want to pay attention to all three parts of the triangle. Now, a triangle rests upon the foundation. What do I mean by the foundation? The cranial-facial skeleton itself. Sometimes we'll recommend to move someone's chin forward or put in a chin implant or address their cheekbones, sometimes their nose and ears, etc. But keep in mind that we want a natural result. We want you to look your best, and so we need to pay attention to the three part of the triangle, facial beauty, facial rejuvenation on top of the foundation. So, high quality plastic surgery starts with an accurate knowledge of the anatomy. The epidermis, and Amanda's going to meet you soon, and Claudia's here. So the epidermis is what we see. That's the very superficial layer. Keep in mind that the very top layer, keratin layer, is not living. It's like hair and nails. It's just as there as a kind of a moisture protector. And when that layer gets too thick, the skin loses its sheen, you lose your glow, you lose that healthy, vibrant appearance. On top of the the epidermis is on top of the dermis. That's where the business goes on in the skin. The blood supply is there, the collagen is there, elastin is there, hyaluronic acids are there, naturally appearing hyaluronic acids. Now, when we talk a little bit about fillers, you're going to maybe hear that word again, hyaluronic acids. It's a natural substance that holds on to water. Elastin, collagen, the blood supply, that's where the strength is in the dermis. The dermis lays upon the subcutaneous tissue. That's a fatty layer. The subcutaneous tissue is on top of the muscle. There's a fascial plane. Sometimes the muscle is invested with this tough fascia. It can be very thin and wispy, or it can be very thick like a leather belt. And of course, we get to the muscle. Then the lining of the bone is called the periosteum, and then we get to the bone itself. Okay, now this is a very busy slide, but the point I'm trying to make is that for high quality, effective plastic surgery, we need to address people as individuals. Not everybody grows up in the same place. Not everybody is exposed to the same amount of sun and wind. You don't have the same genetic background. So what I advocate is going through layer by layer. We need to look at your epidermis, dermis, the fatty layer, the muscle, the fascia, look at your foundation, etc. Now, I talked a little while ago about we're programmed to want to look our best. That's healthy. Everybody can look at this young woman and know instantly that this person here is older, and it's actually the same person, but it's 40 years later. after exposure to lots of sun and wind and volume loss and changes. And everybody knows this intuitively. It's almost pre-programmed into our brain that you can look at a picture of a person, do a rough approximation of how old they are, and see a baby or a child, and that's just intuitive. So the point I'm trying to make is every patient deserves a custom designed approach, okay? This is not a cookie cutter operation. Not everybody gets the same operation. Not everybody gets the same treatment, etc. You deserve to be treated as individuals. Okay, so facial rejuvenation, the triangle. Now, let me back up for a moment. The skin texture, like I said, fine lines, dyspigmentation, liver spots, age spots, etc. And Claudia's here, and Amanda's going to come back over, right? So when we talk about your skin, that's things like peels, laser, TCA peels, phenylcrotonyl peels, all kinds of treatments that I want to have Claudia and Amanda talk about. So everybody in California, you probably love the outdoors. That's part of why we're here. But the UV rays of the sun and the wind, it's just not healthy for the dermis. It can disrupt the collagen. The collagen gets thin, disorderly, etc. So when we talk about skincare, I'm going to go through this very quickly because I want Amanda and Claudia to address this. If there are 6 things I could tell you about how to take care of your skin, number 1 and number 6, avoid the sun and avoid smoking. You also need to learn how to properly cleanse your skin. Exfoliation is that process where we get the very top layers to shed. Restoration is when we turn on that germinal matrix layer. That's like the factory that makes the new baby cells. And of course, moisturizing is very important, especially when we're exfoliating. Because if we are removing that very top layer, we don't want to dry out the skin. So we need to properly moisturize the skin. And you'll learn how to do that by seeing Amanda, and we can teach you how to do that. One thing I want you to know before we go on, it takes a minimum of 30 days. If we make a new baby cell, it takes a minimum of 30 days for that baby cell to get to the top where you can see it. So sometimes I hear people say, oh, Dr. Morwood, you and the esthetician put me on skincare for 2 weeks and I didn't really notice a difference. Well, you haven't even given your skin one chance to shed, one turnover time. It's got to be minimum 30 days. So just imagine if you hung in there for 6 shedding cycles, 6 months, or 12. It'll make a big difference in your skin, but you've got to hang in there. There's Amanda. Amanda, come say hi.
Of course, yes.
Here she is. I'm going to ask her to say hi to the gang. So Amanda's going to be able to say hi to the gang afterward. Okay, so we want to base whatever we do on science. We want to offer you real results. So this is a skin biopsy. Dermatologists and plastic surgeons can do this kind of thing. So there's a skin biopsy with kind of a thick thick keratin layer, pretty thin collagen layer, disorderly. And there's the same person after about 6 months of skincare. So we can thin out the keratin layer, we can increase the collagen, increase elastin, increase the orderliness of the skin. It really works. Now, I'm talking about the skin, okay, the surface of the skin. And under there we put laser, we put crotonyl peels, we put TCA peels, skincare. So here's a before and after lent to me by a friend. And what you see is improvement in the texture of the skin. But it's not true that extra skin has been removed. Skin has not moved around. So what I'm an advocate of is the facial triangle, the triangle of facial beauty. We want to custom tailor our approach. We're going to treat your skin with this. We're going to treat volume with this. We're going to move tissue with this. And it could all be on the same day. But let's not confuse a laser treatment with a facelift. Sometimes you might hear from different not here, you might hear about a laser facelift. This laser is a great replacement for a facelift. I'm not an advocate of that because laser essentially, there's different types of lasers. There's YAG laser and argon lasers, etc. It comes down to heat generation. The energy is transmitted in heat. Now, let's look at bacon. Everybody knows what bacon is, even if you don't eat it. You could take a strip of bacon out of the package, you could practically tie a knot in it. It's supple, it's hydrated, right? It's mobile. Certainly if we heat that protein, it's going to shrink. We know that. But it becomes brittle. You could break it. Now, imagine if you cooked the skin so much that you were trying to get away, that we're trying to tighten the skin and do a neck lift, etc. Well, that's the opposite of what we want, because we want hydrated, supple, soft skin. The reason I show this, my staff found this for me, is because when the only tool you own is a hammer, the whole world looks like a nail. And what we want to do for you is take care of your skin. We want to have med spa treatments be appropriate, of course. We want the surgery to be appropriate. We're going to help you choose between fillers and fat grafting and Botox, etc. Whatever works, but it's custom designed. Now, TCA peel. Again, keep in mind we're on the skin, okay? Remember the triangle of facial rejuvenation, triangle of facial beauty? 3 parts, we're on the skin. What I like is for people to bring in photographs of maybe their favorite decade, or when they're in their 20s or 30s. So we look at that, and I can study the fat compartments, study how you've changed. So this gal brought this photo in, and there she is in my office about 40 years later. So I want to show you her 6-week post-op, which is there. Okay, let me back up to go from there to there. Now, my wonderful staff has reminded me not everyone is accustomed to seeing photographs of people coming out of the operating room or 1 week later. So the next image I'm going to show you is about 1 week after we treated this gal. Okay, so there she is in the middle of some exfoliation. So TCA peel, I'm going to group these things together just for now. I'm going to be oversimplistic. Let's group together croton oil, phenol peel, TCA peel, laser treatment, etc. So, for example, TCA peel, nothing really happens for 5 or 6 days. And then for 5 or 6 days, you're going to rapidly exfoliate and shed. Okay? And then you have pink skin, which you can cover with makeup, and it takes about 6 weeks for the pink skin to fade. Okay? So here she is about a week after surgery. So there she is 6 weeks later. There's how she started. Okay? There's about 6 weeks result, and there she is about 1 week after the operating room. So it's interesting that sometimes our skin treatments have a more rigorous recovery than the surgery. Sometimes after, just say, an isolated neck lift, people are back at their desk and they don't mind interacting with the public on day 4. But if you're going to have laser resurfacing or peeling, you're probably not going to want to have your picture taken for a couple of weeks. Okay, here's another gal. Now, if you look at her, you see textural changes in her skin, but we also see volume loss. Okay, so just imagine if we reposition some of the soft tissue to where it belongs, if we help to revolumize and we resurface the skin. So there she is about 10 days after the peel. She is in that exfoliating stage. Keep in mind, about nothing after TCA peel, nothing happens for 5 or 6 days. Then for 5 or 6 days you exfoliate, then you have pink skin. So there she is during that exfoliation stage, and there she is at about 8 weeks. So let me back up. That's how she started, that's in the middle of the peel, and there she is about 8 weeks later. Okay, so I hope you're starting to get the idea. If we use the triangle of beauty, and we look at your skin, we look at the volume, we look at your soft tissue position and amount, we can give you a much more natural look and longer lasting and effective change. Now, oftentimes I see ladies, and occasionally on a man, talk about their perioral lines. I've even had women say, you know, I don't even use a straw, but I still get these lines, or I don't smoke and I still get these lines. Perioral lines come from a number of reasons. But I treat these with a custom designed approach. We've got to look if you need volume. We have to look if you need plumping. We have to look if you need resurfacing. What's going on? So here's this gal after perioral treatment. For her, I think I did dermabrasion and a little bit of fat grafting. Okay, so once again, I'm going to keep showing this slide because I think it's really important. The triangle of facial rejuvenation, triangle of beauty. Skin texture, volume, soft tissue transposition on top of the foundation. So here's a little darling, and you all know from babies that people love to come up and pinch their cheeks, right? That's because they have volume. That's fat. So fat in the right place, the right amount of fat, is good. Not all fat is bad. We like that. So I said, as we mature, we tend to lose fat cells in the face and hands and put them on in the trunk. It's an unfunny practical joke. Okay, so how do we revolumize? There are two broad categories of restoring volume. The first is fillers, and we're lucky to have a nurse injector. Fillers are like Juvederm, Voluma, Belotera. There's like a new filler about every month that comes out. Most of the fillers we use are based in hyaluronic acids. Some of them have a calcium base that's called Radiesse. It's like toothpaste. It tends to go very deep. There's another filler we don't use very often, a PLMA, very complex molecule called Sculptra. But for intention purposes, most of the fillers we use are hyaluronic acids. The other way to do volume restoration, volume rejuvenation, is with the use of your own fat. Now, what's fat grafting? Fat grafting is when we do a little conservative liposuction. We spin the fat down or centrifuge it or decant it. We keep it sterile, and we re-inject the fat into other places. Bring the chin forward, fill up the cheeks, higher cheekbones, sometimes temple wasting, fill up the nasolabial folds, etc. It's your own body's replacement for the fat that you've lost. It's called fat grafting. Now, we need to overcorrect because about 67% of the volume will persist. So we need to overcorrect. We need to put in more than you're going to need. So if you're going to have fat grafting, you're going to be swollen for about 3 weeks. And then it starts to recede. And then studies actually indicate that fat, like, it takes root. And if you ever gain weight, it gets bigger. If you ever lose weight, it gets smaller. And the news is, guess what? The same as if you didn't have fat grafting. If you put on weight, you're likely to get bigger all over. If you lose weight, you're likely to get smaller all over. I show this because in California, everybody knows about grapes. If you put the grape out in the sun and it loses volume, it starts to shrink, same as a plum going to a prune. In fact, I've had women come into the office and they say, Dr. Morwood, I feel like in the past 2 years, suddenly I've gone from a plum to a prune, or I've gone from a grape to a raisin. That's volume loss. Now, let's think of maybe the traditional way, I don't know, the old way to do facelifting. We make an incision and we pull hard enough to stretch out all the wrinkles, and then we cut off the extra skin, and then we sew up fast enough so the skin doesn't spring back. That might work, but that tended to give people kind of a flattened appearance. What we want to do is lift and fill, volumetric restoration, okay? Once again, it's the triangle of beauty, 3 parts to it. Okay, so skin texture, volume, position, and structure. Now, I'm showing this because regardless of your gender, your ethnicity, men, women, wherever you're from, volume is great. It helps to maintain a projecting face, and that's what we want. So, for example, as I said, Claudia and Amanda and Tara are going to say hi. Here's a gal who came to the office, and she said that she feels like she's losing her high cheekbones, and she liked that look. And so in the office, filler is like a lunchtime treatment. So we take it off the shelf. It comes in a sterile box, in a sterile syringe with a needle. We can give them numbing medicine or ice and topical cream, etc. So we can put that filler where you need more volume. So we go from there to there. See how the light reflex just catches the cheekbones? Everybody knows that expression, high cheekbones. Men and women, the models, you got to have high cheekbones to make it in the glamour industry. That's what we're talking about. We're talking about volume. Now, here's another gal with really beautiful eyes. She came in and she noticed that, once again, her mid-face and her cheekbones, she thought that she knew she had more volume in her cheekbones before. So in the office, with topical treatments, topical numbing, etc., we can inject filler, hyaluronic acids. Usually I put these down pretty deep for this type of thing. So in the office, we can go from there to there. See how? That's such a great question. Claudia, did you hear what she said? She asked, is Botox a filler? No, but that's a great question, and I'm going to get to that. Okay? They're both injectables. They're both they both come in a syringe. They're both done with a needle, but they're totally different substances and uses. Okay, but thanks for asking that. Okay, so one of my favorite uses for a filler is if someone has very early formation of pouches in the lower lid. They're not ready for surgery. They want a lunchtime treatment. They're going to have their pictures taken at a wedding, or they have a big event coming up. So why would I use filler for pouches? It almost seems counterintuitive. But if we have a hill and we have a valley and then we have a mountain, how about instead of shaving down the mountain, we just fill up the valley, and so we have a smoother contour. So a big concept in the attractive face is the eyelid-cheek junction. So someone has very pronounced grooves, we call those the tear trough, between the eyelid and cheek. That's a very pronounced eyelid-cheek junction. So let's fill that up with fillers right in the office. So then we go to there. Okay? It's for someone not quite ready for surgery and they want a lunchtime treatment. That's a great use for a filler. Okay, so I'm going to wear this slide out, but I want you to keep in mind that for effective, high-quality, natural resulting appearance of plastic surgery, we really need to pay attention to that. I'm just checking the time. Okay, I think we're okay. Everybody all right? Okay, now, that's fillers. Right, Claudia? Juvederm, Voluma, we have nurse injectors, and Amanda and Tara, they're great. Now, what about fat grafting? Hello.
Fillers, yeah. You mentioned several different layers of skin, right?
Yes.
How much those fillers go inside?
Okay, I think I understand your question. There are different fillers, and some are very thin like an oil, and they have what we call a low G value. If they're very thick, they tend to go deeper and they have a higher G value. They're heavier. So for example, Voluma. It has a high G value and it goes deeper and it's thicker. Bellotero is almost like an oil. It can go more superficial and it has a low G value. So custom designed approach. What are we trying to fix? Are we trying to bring your chin forward? Are we trying to elevate your cheekbones? Or are we trying to fill in the very delicate thin skin of the eyelid? Are we trying to fill in maybe a line? Okay? Different fillers, custom designed approach. Great question. Great question. Okay, so we're talking about volume. So one big category is fillers. Another category is the use of your own fat. So here's what we do. We do conservative liposuction, and we get that fat from the tummy or flanks or love handles. My staff won't let me use this phrase, saddlebags, but they'll allow me to say love handles in men. I don't know, it's kind of a gender discrimination thing, but that's okay. So we do conservative fat grafting. We let this fat decant or spin it down, centrifuge it, and then we take that fat. It's your own tissue, and we inject it with a very fine needle or cannula to restore the volume of the nasolabial folds, bring the cheeks higher, cheekbones higher, bring the chin forward, etc. It's a natural filler. Now, the reason why I put stem cell rejuvenation here, I'm board certified, and our society doesn't recommend that we use this phrase stem cell facelift. Now, it's true that 1 out of every 176 cells that we suction out and transpose to the face, it's a stem cell, and it can help rejuvenate, and we bring up some estrogen receptors, we bring up some vascularity, but I think that a stem cell facelift, really, it's kind of a misnomer. But we do bring up your own fat cells, some estrogen receptors, some stem cells, vascularity, etc. And the grape and raisin principle. Okay, so let's look at some examples. Here's a gal who does not have a lot of extra skin, but she's missing some volume. So she had volume replacement and very conservative lifting. Just to go from there. So let me back up. From there to there. Now to me, this gal could go out to dinner anywhere and not really have that pulled, stretched look, right? Why is that? Well, we judiciously went through the triangle of beauty, facial rejuvenation, don't pull too hard, lift and fill, okay? Custom designed approach. Now, here's a gal. If you look at her, it makes me think of like an air balloon, right? You just take a little bit of the water, a little bit of the air out, and you just get a little sag, right? So let's lift and fill and restore. Okay? Now to me, that's not an over-pulled or overstretched look, but we have to pay attention to the triangle of beauty. Are you missing volume? Is it your skin, soft tissue, position, and amount? Now here's a gal who has profound volume loss and extra skin. So let's do some volume restoration. Let's address her skin prep with Amanda for about 6 weeks, reposition soft tissue to there. Now let me back up a second. Now, if you look at the volume of her face, and in her post-op about 2 months later, to me, she almost looks wider. We want to restore that, right? We want a face that projects. We want a face that's defined. We don't want a face that's pulled too hard. Now, one of my favorite areas to do fat grafting is the submalar hollowing. Sometimes women lose fat in their face and they get these little hollows here. Sometimes it happens to men as well, but I think it's most to do with hormone changes. So fat grafting, about 10 cc's each side. We can do this right in the office to fill up the cheeks to go to there. You notice the difference? Submalar hollowing, and now there's more fullness. Botox. Thank you for your question. Okay, now I'm going to ask Claudia to talk about this. Botox we also do in the spa. It's an injectable, but it's totally different from a filler. Botox is a muscle relaxant. So let's think of them, it's called the mimetic muscles, or muscles of facial expression in the face. Think of an accordion, right, going back and forth, or a piece of paper. If we were to fold a piece of paper 10,000 times, even when, at a certain point, even when you stop folding, there's going to be a crease. Botox is a muscle relaxant. So for example, the furrows here in the glabella, some of the squint lines, some of the lines in the forehead, if we get the underlying muscles to relax, then the overlying wrinkle or ridid or line will soften, okay? So Botox is an injectable. It's not a filler, it's not a volumizer. But the truth is that sometimes people confuse Botox and fillers is because we sometimes use them in conjunction with each other. Let's say we have a very deep crease that's caused by the action of the muscles. We'll do a little Botox, maybe get 50% improvement, and sometimes people come in and they say, it really worked, but I want more improvement. Then we may go to a filler to revolumize. But Botox by itself, I think is great, especially around the eyes. Softens glabellar lines, softens squinting lines. We can actually do some shaping of the brow because we know the depressors of the brow. There are 3 main depressors: the procerus, the corrugator, and the orbicularis oculi. And there's one major elevator, that's the frontalis muscle. So we can selectively get the depressors to relax while letting the elevator take over, and we can do a little microlateral brow lift. Okay, so here I go. Here we go. The procerus and corrugator and orbicularis oculi are depressors. The frontalis is the main elevator. So here's a gal who works with the public. She came into the office and she said, my coworkers say to me sometimes in the morning, did you break up with your boyfriend, or did you have a fight? You didn't sleep last night. You look like you're in a bad mood. She's a happy-go-lucky gal. She's very delighted, but she just has that look of consternation, like she's sort of concentrating on something, and she was. So here's in the office, about 30 units of Botox to the glabella, and here she is 2 weeks later in the office trying to give that same expression, okay? So it's a muscle relaxant, okay? That's Botox. Now, another, I don't want to bore you, but we could show you these all day. Glabellar furrows, from that look of consternation, concentrating, there it is with the Botox softening. Now, I want to point something out, that when the lines are deep, it's not perfect. I mean, it's like, you know, the piece of paper that we're folding, right, 10,000 times, because even when you stop folding it, there might be a crease. So in certain circumstances, we'll do the Botox, people will get a result, and then they say, well, can we get a little bit more improvement? That's when we could consider fat or a filler, okay? So again, some forehead lines, glabellar lines. We want a natural look. I don't like to give people really frozen faces, so I'm judicious with it, but it works great around the eyes.
How long does it last?
Okay, great question. So Claudia, I tell people Botox lasts 4 to 5 months-ish. Some people more, some people less. What I find is if we do it a few times, then those muscles never regain their original strength, and so you have to get Botox less often, and you have to get fewer units. Because it's kind of like putting your arm in a splint or cast. If you change the cast in 4 months and put a new one on, and then another 4 months later put another cast on, eventually those muscles will never recover. So that's like Botox. Okay, the triangle of facial rejuvenation. So finally we get to what most people think of as plastic surgery. So let's review. So we've talked about the skin texture, right? Laser, TCA peel, phenol crotonol peels. We've talked about volume, fillers, fat grafting. Okay, now I want to talk a little bit about repositioning. Most plastic surgeons, including me, we like to look at the face in terms of thirds. The upper third is from the upper eyelids up. The middle third is like the cheeks and the lower eyelids, and the lower third, of course, is the neck and jowls. So here's a gal who's good looking. She has great looking eyes, but her brows have come down, and so she gets the brow lift. Gives a much more brighter look. It's surprising sometimes how powerful a brow lift can be. Now, heavy upper lids, that's called an upper blepharoplasty. This gal came in and she said she has lost the creases of her upper lids and wants to know where they went. Can we bring them back? What she had was extra skin, redundant skin. So let's trim those up to show off her pretty blue eyes. Yes, okay, so now we're on the third part of the triangle, which is the soft tissue position and amount. This is incisions. Okay, so there, let's see, we went from there to there. Here's a gal with another gal with really good looking eyes. She wanted her crease back. Just to give people creases oftentimes just makes them look better. Here's a gal who had a little bit of lateral brow ptosis, heavy upper lids, and at the same time I lifted what we call the malar area, the cheekbones, just a little bit to give her a brighter, more relaxed look. Okay, so I said we started at the top. We're doing this in thirds. We talked about the brow. We talked about the upper lids. Keep in mind, please, that we do another seminar. All we talk about are the lids and brow for about an hour, and we can talk about neck and jowl for about an hour, etc. So I'm kind of going through this quickly. Excuse me. So Michael, when we edit this, they're going to know that I'm an actual doctor, actually drinking real water, and we're just not faking on TV, right? Okay. I had to catch my breath. Okay, so the mid-face. The mid-face is one of those areas where volume is so important. If I picked one area where I do the most fillers and the most fat grafting, it's the cheekbones for the mid-face. So as that mid-face loses volume, it allows gravity to pull down. It accents the lower eyelid pouches. We get what we call mid-face descent. Tissue starts to descend down into the jowls and the neck. So the mid-face volume is so important. Okay, so here's a gal who wanted something done in the office. She didn't want a big anesthetic. She didn't want to go to the hospital. She felt like she had lost volume in her mid-face and things were sagging. She has what we call mid-face descent. So in the office, we can reposition things. See the difference? We go from there to there. So as we lose volume in the mid-face, and it allows gravity to pull down and things descend, we want to reposition those tissues. So keep in mind, my approach, I spend a lot of time addressing volume and paying attention to volume instead of pulling really hard and cutting off extra skin and sewing up so quickly before the skin has a chance to spring back. So repositioning volume is a big deal. So here's a gal who came down from another city and she said she wanted fillers. I said, you know, by the time we do fillers and we have to buy all that product, you know, you're going to do better with a mini lift in the office. It's going to be less expensive and longer lasting. So she got a mini lift, just smoothing out things, etc. So keep in mind the grape and raisin principle. We've talked about how a plum can become a prune, how a grape can become a raisin. So we want to lift and fill. We want to reposition. We want to pay attention to volume. So here's a gal who has profound volume loss. Remember how I said when people lose volume in the cheeks, It allows the gravity to pull down. And what that does, it pulls on the lower lids. There's something called the orbital malar ligament. It pulls on that ligament, and it makes the eyelids look even more saggy than they are. So what she needs is volume, conservative repositioning, pay attention to the triangle. So she goes to there. Okay, so we're going down in order, right? Let's talk about the lower third. You've probably heard about the natural neck lift. It's one of my favorite procedures. What it is a system of careful analysis evaluating appearance, anatomy, and goals with a custom designed approach. So the first way I do we have to go layer by layer. We've got to look at the skin, we've got to look at the fat, we've got to look at your muscle, we've got to look at the sublatissimal tissues. So the first way I do the natural neck lift is pay attention to the skin, and we'll have Amanda talk about that. We have to be very, very careful with resurfacing the skin of the neck. It has a relative shortage of what we call pilosebaceous structures, the sweat glands and hair follicles. We've got to be very, very careful, very, very judicious. I can be aggressive around the lips, the nose, the forehead, moderately invasive with the cheeks, very delicately with the neck and the eyelids. So what about when someone has just extra fat? I make a little incision in the crease just under the chin. I make a little incision where the earlobes meet the cheek, and I can vacuum and mold and shape and tailor. Now, maybe if Claudia has time, she can talk about Kybella. It's another way to melt fat. But this is microliposculpture. So here's a gal who has good skin. She doesn't need anything done except remove extra fat. So just with those three little incisions, one in the crease under the chin where most Americans have a scar anyway because their little brother pushed them down the stairs or they tripped or fell from their bike, and one little incision where each earlobe meets the cheek, okay? And we can mold and shape and tailor, okay? Now, what I want you to notice is that we started out with good skin quality. She has good tissue, but she has extra fat. So let's do a custom designed approach. Let's address what she needs, what she or he needs. It's kind of like a fisherman going out on the bay with a whole tackle box. Well, what's going to bite today? You know, you can take this lure, you can take these worms, you can take this crawdad, but we need a custom designed approach. Somebody here must like the fish. I mean, come on, besides me. This works great for guys too. Microliposculpture. It's almost like a big needle being put in. It's a thick needle. It's called a cannula. It's a tube. So it works great for guys when the fat needs to be addressed. Now, here's an interesting case. I'm trying to teach you about how we address these issues. She does have a little bit of extra fat, but she has extra skin. So what she needs is to have her fat addressed, and she needs the skin addressed to go from there, her natural neck lift. Now, I want to put some of these things together. Here's a gal who has lost volume. Her skin is a little bit weathered, and she has soft tissue redundancy and descent. So let's address all three. Let's buff up her skin with a TCA peel. First, she got some skin care to get her skin ready. She got fat grafting, and we repositioned her soft tissue, her skin, to go to there. Okay, so I'm going through these kind of quickly. The reason why I show something from my favorite sculptor, Rodin, is because this stuff is not just for women. Men, especially men, with a strong, firm, tight chin and jaw and neckline, it can be really effective. And of course, we need to look at the triangle of beauty. Natural neck lift. It's a system of careful analysis, evaluating appearance, anatomy, and goals with a custom designed approach. So here's a guy who's very active and healthy. He felt like he had lost volume, and he feels like he looks tired. So conservative, properly designed surgery. He looks brighter, more vibrant, etc. From the side view, you can see a stronger chin and jaw and neckline. I think it's great for a guy. Here's a guy who came in and he said, Dr. Morwood, can you do a waddlectomy? He says his grandkids reach up there and grab and say, hey, turkey man. And so just to trim that up, and here's a guy who has lost some volume, but he has that redundant tissue in his neck. Let's put it back where it belongs. He looks a little broader. Now, my own personal approach, I used to work. I used to work in Hollywood. I worked at USC. I was chief resident there for a couple of years. Men, we've got to be very conservative with the face. We don't want to pull too hard. Women tolerate more change in their face than men do. Now, men in the neck, we want a crisp, clean, firm, tight jawline, but not the face. So we go from there to there. Now, here's a gal who has profound changes, but she's got a little bit of extra fat, she's got a little extra skin, but her laxity, her looseness is in the muscle, in the platysma muscle. So what did she get? A platysmoplasty to tighten up that muscle. Okay, I'm going to give you this take-home message. So here's a guy, let me back up one second. Remember when I said the triangle of beauty, facial rejuvenation lays upon a foundation. So we have to sometimes look at the cranial facial skeleton, look at the chin, look at the cheekbones, look at the ears, look at the nose. So here's a guy who has great skin. He doesn't really have any extra skin. He has two things going on. He's got a little bit of extra fat, and his chin is retrusive. We call that a weak chin, right? So I made a little incision inside the lower lip, and I brought the chin forward. And then through those little 3 incisions where the earlobe meets the cheek, one on each side, and a little incision under here, we can sculpt him. Okay? Bring the chin forward. There's a number of ways to do that. Chin implant, fillers can do some of that, fat grafting can do some of that. I did what's called a genioplasty, a bony genioplasty. We'll bring it forward, okay? So we go from there to there. Much stronger, virile, masculine look. Now here's a gal who has a little disproportion. Her chin is weak, her nose is kind of prominent. She doesn't need a lot done, but let's go for some rebalancing. Bring the chin forward, okay? So we go from there to there. If there's anything you're going to take home, it's custom designed approach, combination of science and artistry. Pay attention to the triangle of facial rejuvenation, facial beauty. And I am going to thank you for your attention, and I'm going to ask wonderful Tara and Claudia and Amanda to come on up front and say hi and talk about the spa a little bit.
My name is Claudia. I'm the laser and aesthetic nurse. I work here in the med spa office and also at the Salinas office. I do your Botox, filler, cool sculpting, laser, and Kybella as well. So if you have any questions, just let me know. You can also do a consultation, and again, we look at your face. What is your concern, and then we go from there.
What's Kybella?
Kybella is removes any excess fat that you don't want, and it's permanent.
Can you tell us how much training you have? How do you get to know this? How to do it?
So you don't have to do a lot of training, but I'm a registered nurse, so the injection part is kind of simple, but you have to learn how the face works, like Dr. Morwood was explaining, the triangle, the drop. Every year as we get older, our face drops, we notice a little more loose skin. So we take all that into consideration. Everybody has a separate.
And you and the doctor work together, as in he
No.
says, no, you decide.
Yes.
Okay.
So I do Botox, the fillers, laser, and then I give you my recommendation for whatever you would like, and then he does the surgery, deeper procedures.
But if you come in, you can see the staff at the spa and get an opinion, and
Yes.
sometimes they call to me, and oftentimes I'll say, hey Amanda, come on in, and we're around.
We work together. Yes, we
Yeah.
work together. Yes.
Do you use anesthesia?
Anesthesia, we use a cream to kind of numbing cream. That's what we use. And we actually have a new procedure. It's called the
Oh, the Pronox.
Pronox.
Yes.
We just got the ability to do a little inhalation sedation in the office. Some people have been to the dentist and they give you what they call laughing gas. It's nitrous oxide.
We can do that here in the office now. So if somebody, is reluctant or they're afraid about needles, or when I numb people up to do a procedure, you can get a whiff of that.
Kind of helps relax you and tolerate the procedure
What's
better.
cool sculpting?
Cool sculpting is permanent.
Permanent fat freezing. So depending on what area of your body you would like to have done, It permanently freezes the fat cells that you have underneath the skin.
How does the body rid itself?
So the body reabsorbs it, and then you excrete it through sweat, urine, on the yucky waste. It takes about 90 days to see the permanent results. If you gain any weight, you won't gain it in that area where you have the procedure done,
So
because
a
it's permanent.
procedure.
Yes. It's just not as invasive.
Are most of the procedures that you do, I know Botox is not permanent.
Mhm.
The other things that the doctor talked about, are they considered permanent or permanent for 5 years?
So fillers are usually about 10 to 12 months. I think the Voluma is the only one that's about 2 years. And then you have to come in. And then the Botox, like he said, just depending, could be anywhere from 4 to 6 months. But it's better to do it more over time because you need less.
In general,
Anything else?
if somebody asks me how long will their neck lift last or facelift last, in general, we say 7 to 15 years. There was a fascinating study in New York City where identical twins came in to see the plastic surgeon, and one of the twins had a facelift and one did not, and they followed them every year for about 20 years. And the person who had the facelift never looked as aged as the twin, but after about 7 to 15 years, they started to catch up.
Thank you. Any other
Thank you.
Yeah, so exactly how many fillers are there and why wouldn't you use the one that lasted longer for the 2 years?
Like Dr. Morwood said, every filler is different depending if you want to use it for volume, for lifting, for fullness, for softness. It just depends on what you would like done on your face. Depends on the one that we use. There's like 5 to 7 different ones that we could use.
And if a client or a patient suggests something that you think is not
I see what
good for them, you just tell them straight out, or do you do what they want?
No, we are very honest. We give our recommendation and then they choose whether, we don't like to do anything that's gonna be too much or not enough. It has to be subtle. Like people are gonna notice, oh, you know, you did something, but they're not gonna know what you did. And that's what we want for our patients, subtle.
What do they use to do the freezing for the cool sculpting?
So it's a machine.
Just adjust the thing.
It's a machine, and depending on which part of the body you would like to get it done. So what it does, it cuts like a vacuum, and it just sucks
Get
the
all these
skin
out.
and all the fat tissue underneath, freezes it for about an hour. And then we remove it, and it kind of looks like a butter stick. And you just massage it really good. You can have a little bit of bruising, but that's about all the pain you're really gonna feel.
Can I talk about that just for a few seconds? So what researchers noticed was that people who rode horses a lot in very cold climates like in Scandinavia, and they wore these kind of chaps and clothing where the lateral hips were exposed, the so-called, that's where the term saddlebags comes from. With long-term exposure to cold, they actually noticed that their hips got smaller. And some children get almost addicted to popsicles. And the pediatrician started noticing that these kids who sucked on popsicles for hours and hours, for days and days, they actually lost fat in the face. So these Harvard researchers started studying, it's called cryotherapy, I guess, where the fat is frozen, and then over the course of the next 4 months, the body will kind of melt it and resorb it.
Any other questions?
Amanda, you want to talk about skincare? Oh, and don't we have kind of an introductory special where people can come and meet Amanda and get a little treatment? And,
Yeah,
isn't that
so
true?
since we're a new office, we're offering free facials pretty much to Dr. Morwood's patients, where they can come and have a consultation with Amanda and kind of just learn about skincare and any problem areas or things that you might want a little recommendation on how to go about treating it. And then Amanda will explain the facial processes that we have, and then we can offer you that.
So hello, my name's Amanda. I'm the esthetician at the Rejuvenation Med Spa that's connected to this office. So I do different skin treatments. We do a dermal infusion, which is basically our most popular treatment. It uses a microdermabrasion diamond tip, which is kind of like a it looks like a little brush head, but it has a little bit of grit to it. It removes dead skin. It uses vacuum suction to get any impurities out of the skin, and then it also infuses a serum into the skin at the same time.
What about big pores? I don't know what the technical term is, but.
So
The technical term is
Big pores.
yeah, large pores. So we're all born actually with our pore size. Depending on your pore size, you're either oily or dry or normal skin. So with the dermal infusion, that's a really good treatment if you have larger size pores to kind of extract the impurities that you have going on there. And then we also have skincare products. We have our Zeo Skin Health, we have Skin Medica, we have Tizo, which is a really great sunscreen and primer. But with our Zeo Skin Health, they actually have a product specifically for shrinking the pores. So if you come in, we'll do a consultation. We can get you on a skincare regimen. I can recommend different treatments. We also do peels. We do. I would do the dermal infusion and maybe like a combination of a dermal infusion and a peel as well. That would be great for, you know, pores, and then get you on a good skincare regimen where you're exfoliating regularly. And then also we carry skincare makeup, and I think that's about it. Like toners and waxing, do eyebrow waxing, upper lip. If you want to do your full face, we could do that. And we also do dermaplaning, which kind of scrapes off any dead skin, any vellus hair, which is, you know, our little baby hairs on our face that are really light. So it takes off everything off of your skin, off that first layer.
And waxing is a word that means take things off?
Waxing is hair removal, so we apply like a warm wax to the skin, and then it'll dry on its own. That's hard wax. And then we also have soft wax where I use that with strips.
Okay.
So anyone have any other questions?
You guys also do that Latisse stuff?
We do. We sell Latisse. We do. We definitely, you would have to come in for a consultation first if you wanted to purchase it. And we would explain how you use it. And you would, you know, go over all of like the care that you have to do during it, and then you would purchase it.
If you want longer hair or thicker eyebrows, you come see me. Okay?
I have a question.
Yes.
I'm having a facelift the end of January. So what sort of preparatories do I need to do?
So I would
Special or
recommend, I actually just had a patient I was just talking to who's getting a facelift, and I recommend a skincare regimen for you. I'll recommend a good cleanser, exfoliant, toner, sunscreen, getting your skin ready. And then we would do maybe like a lighter peel or start with the dermal infusion just to get your skin acclimated and used to those ingredients. So when you go in for your facelift, or, you know, if you get a more abrasive peel with Dr. Morwood, your skin is prepped for it, basically.
So I would work with the doctor and you tell
Yeah, we usually work together. And
So that's a great example. But before we ask Tara to speak, that's a great example. Like, say you all talk with me and we talk about your skin and volume and soft tissue repositioning. Then I'll have Claudia and Amanda come in the room, or we bring you over there, and then we coordinate a prep to get you ready for. And
a regimen to get you going.
Too, to save your result, preserve your result, and improve it.
yes, you're always going to get better results if you start with skincare, do the facelift, and then you're coming in regularly. Because like Dr. Morwood said, as we age, the cell turnover, it slows down. So it takes about 30 days for those new cells to come up. So when you are exfoliating regularly, getting peels regularly, or dermal infusion, you're speeding that process up.
maintain.
Yes.
Yeah.
Maintaining your result.
Tara, you want to talk about the
So I'm Tara, I'm the receptionist and kind of the front office of the spa. We're open Monday through Friday right now from 9 to 4. For the most part, Amanda is available Monday through Friday. Our nurses are a little more sporadic, seeing how they also work in our Salinas office and in the hospitals locally. So we are pretty flexible right now, seeing how we're new with our appointments. You can either call us directly, or we work hand in hand with Dr. Morwood. If you were here for an appointment and wanted to come over, we can fit you in that way. We also try to accommodate that if you do have an appointment with Dr. Morwood, we can try to see you the same day. We just have to decide if we would see you first or second, depending on what was getting done. We are a cash-only spa, seeing how most cosmetic stuff on our site is elective, but we do take care credit as well, and we have Brilliant Distinctions, which is it's a point system you get for getting any fillers or Botox, skin medica products. Every time you purchase or have something injected or treatment, you get points, which turns straight into cash for you for your future treatments or products. So that's kind of nice. And you don't have to have anything done to purchase our products. You can just come in if you want to pick up a nice lip gloss or foundation or even creams and sunscreens. We have some really nice sunscreens. So. Alright, and if also, just to throw out there, if you have been a patient in our Salinas office, we can just transfer you here vice versa, depending on where you live. So, it's something nice.
So you
too.
just opened this office?
In August, we opened our Monterey location, yes.
The med spa.
Yeah.
So everybody, thanks so very much for coming.